Good afternoon, everyone. My name is Ron Sticka. I'm the Executive Director of the Kim Sticka PTSD Music and Arts Foundation. We do sponsor an annual symposium, and this segment is part of our third annual symposium dealing with the topic of culture and its impact on trauma. So this particular one, we will be talking with uniformed service, police, first responders, and people who are generally regarded as disciplined, but what culture enters into the type of work that is done, given all the stresses and trauma that are encountered. And so I think what I'm going to do is start with Colonel McGann. Sean, welcome back. You're still en route from Kosovo for the last year. Sean, with the Oregon National Guard, has been the U.S. Senior Representative in Kosovo. Welcome, Sean, and I'm going to turn it over to you right now.
Hey, thanks, Ron. And good afternoon, everyone. Hopefully you can hear me. I'm on day 13 of quarantine down here at Fort Bliss, Texas.
You're coming through well.
Hence, you also see that I may not have the most military appearance right now. I'll start off by just saying I'd like you to keep the number 3 in mind. This is a 3-hour presentation, right, Ron?
It's a 2-hour presentation with an hour left for questions.
Okay, roger that.
You're not going to go 3 hours, however.
And let me know when I'm getting close to the end. So quick background about me. I've got about 32 years, almost 33 years of military service, Reserve, National Guard. Goes to show you it's not part-time anymore because almost 10 years of that has been active duty with deployments and missions. I retired from the Eugene Police Department with my civilian job, my other career, after almost 27 years, just about a year ago before I deployed. And I served on a host of special operations there, SWAT, bomb squad, gang team, and school resource team, which was actually one of the more fun ones. So I come from a family that's multicultural. My wife was born right across the border here in Ciudad Juarez in Mexico. I can't go there, A, because I'm in quarantine, and B, because it's off limits. Since I retired, I've become a volunteer with Rotary International. I work a lot with Honor Flight, and we take World War II, Korea, and Vietnam veterans back to DC. Done over a half dozen of those, which has been incredibly rewarding. And my wife and I are trying to start a program, Shelter for Heroes, to house homeless vets over in Redmond. So a little bit of background, and that's not really a unique part about me. I'm just telling you that background because I'm always amazed at the people that I meet in every field that I go in, but also in the National Guard, because some people see the uniform and they don't see the second career or the whole second part that comes with that uniform. So I want to talk about military and in regards to trauma. And I'd say most of the people here will understand, but that movies do not capture life in the military accurately. Anyone who watched MASH or has seen reruns of MASH knows that that show actually captured the comedy. It captured the irreverence that soldiers can have towards command. Sometimes I'm one of those commands as a colonel, and also the brutality of war. Kind of like Barney Miller or Hill Street Blues capture it for police work. So for the National Guard, I want to focus a little bit more on that on the very limited time here today. We've been involved since World War I, World War II. I mean, we go way back to our formation in 1636. And I will add that we are the very first branch to ever be formed before the Marine Corps, Army, Air Force, or Navy. And we've gone all the way through, Desert Storm. And when 9/11 hit, we are actually approaching the 20-year anniversary of 9/11, if you can believe that. That was an absolute game changer for people in the National Guard, where deployments literally skyrocketed. For us, who many thought were weekend warriors, in literally the first 13 years of my career, no deployments, a lot of training, tremendous opportunities. Everything changed on 9/11, and that really relates to what we're talking about here today. We have a unique thing in the National Guard where we're sworn to uphold not only the state, but also the federal Constitution. So we can respond to, as we did this year, as some of my compatriots did back home, wildfires. Our house nearly burned down. My wife evacuated while I was deployed. Tsunamis, earthquakes, everything else. But we also go on Title 10 missions or federal missions, as I'm coming back from a NATO deployment overseas in Kosovo with Kosovo forces. For our people in the National Guard, our soldiers, our airmen, we're about 450,000 strong, your neighbors. And we have to really be professional in each area. So we have to be competent in our civilian job and then go to the military and be extremely proficient in the military, either during our weekends, during our annual training, or when we're deployed, or when we do any type of domestic response. So therefore, it can be incredibly rewarding, but it can also be stressful. And I always try to put it in the mindset of an 18, 19, 20, 21-year-old, as opposed to me on the horizon part of my career. So we have had a number of developments and insights over the years as we have seen behavioral health is what it's come to be known as. It has become a significant issue over the past 19 plus years. And I'm not going to say that it wasn't before then. And certainly I don't want to diminish anything that's happened, but going back to either Vietnam, Korea, World War II. But I want to focus on the National Guard and what we're doing right now to respond to this. And we cover everybody by what we're doing nowadays, which is good. And I'm seeing great benefits. And I'm seeing a lot of mentorship happen from our Korea, Vietnam veterans. So we have what's called a yellow ribbon program. We actually do meetings and we train up before we go on deployment. We go in, we bring in the families, we do counseling, and we actually get those resources. We find out about the VA, we find out about healthcare. And as I'll talk about in a little bit, that has been shown to be one of the biggest disconnects in the military is the lack of healthcare. When soldiers were coming home in the National Guard and Reserves, when you come home from an active duty unit, you go back to a base, like where I'm at right now, Fort Bliss, a huge base with tremendous support. Picture as a National Guard soldier getting off a plane, going to your armory, go home. And you just did, a significant year of service. So there's a number of other resources. As a police officer, I had to, always be aware of those resources that were out there. The Vet Center has been an incredible one in town. The VA, I have made more late night phone calls to the VA and VA counseling than I care to remember, but each one was critical. I can tell you that. Community and nonprofit programs and many options. Sometimes it felt like nothing was available, but you can't stop thinking that you can get to yes somehow. There's been a big misunderstanding about the role of the National Guard. I think it is crystal clear now in most people's mind about the operational use that we've had. When it comes to what I was just talking about is transition. So I can talk about losing the connection with your battle buddies when you're demobbing. For soldiers who are separating, we lose people for medical reasons who separate out or retiring. And I can tell you as I approach that, it's kind of an odd feeling. So I always, again, try to put myself in the place of those who are going through these significant issues. What is key when people are going through this? I already talked about healthcare. Housing. Housing is critical. And we lose a lot of veterans due to housing. Does anybody know about the Egan Center in Eugene?
Yes.
Yeah, that was named after Thomas Egan, who is a homeless veteran. Jobs is another area that's critical for returning veterans. And we also, it's come up a few times where people have asked me, how come you have military chaplains? Well, I can tell you they are absolutely critical. And they not only act as a non-denominational chaplain, but they're trained counselors. And I have called them, more times than you can imagine to come in when a soldier can't go home for, you can imagine life happens when you're deployed. significant issues. So we'll have about 2 or 3, yellow ribbon events before the deployment. We'll have 2 or 3, after we get back. In those, they're kind of lighthearted. They bring in the family. We'll talk about a number of issues. PTSD and trauma don't necessarily come up in those, but they do provide resources and handouts for people to be able to reference and make referrals back there. We have much better support networks, I can tell you, than the early deployments of 2001, 2, 3, 4. Could it be better? Absolutely. One of the big things I would say is that, when you end up deploying and having soldiers come back, that can be one type of trauma. That is not the only type of trauma that can happen in the military. There's combat trauma, there are traumatic events, there is military sexual trauma. There are a multitude of traumas. There is trauma that happens that people have outside the military. Does that affect their military career? You better believe it.
Sean, are there similarities between culture in the military and culture among police, since you've had experience in both?
Yeah, Ron, great question. And what I would address is this: the stigma in the military is far lower than it used to be in regards to getting help or counseling. Is it still there? Absolutely. If you end up getting a rating, can that potentially be something that you're concerned about if you get a VA rating for PTSD, or if you went in to see counselors? I think.
How about as a police officer? I think it's threatening to self-report as having issues that might be PTSD, right?
It absolutely is. I can tell you that the stigma is still present. It was in May of 2019 when I retired, and it is definitely still there. You have to go through and talk to a counselor only at mandatory times, and usually that's normally after you're involved in a shooting. They go through, they talk to you, you end up meeting with a counselor, they make sure that you're okay to go back to duty. And just like I talked about with the soldiers earlier, boom, you're back on duty the next day. We give. John,
you're just about out of time, but I'll speak just briefly because I share some of that. But I was active duty and then also in the reserve, so I've had sort of the dual career, including the CAT A units, which are entirely reserve units with what they call in the Air Force air technicians. So they're civilians that put on a uniform on the weekends and during actual periods of duty. So it's sort of a unionized form of military, which is highly unusual. So we have a variety of cultures within the military where there even is a little bit of room for clashing and needs to understand, like the Guard people and their frame of reference, reservists. But what I think the community needs to appreciate among reservists and Guard is that we're part-time soldiers and have other lives, that the more military duty we have to do, the harder it is to balance lives. So the stressors are increasing over the past 20 years that you're talking about in particular. And so some solutions are really needed to handle the stress that's creating issues in some people's lives. So any last word what we can do, Sean?
Yeah, really the biggest thing that I would finalize here before any questions later on is that reaching out to people cannot be underemphasized. I think that's one of the key things. That's what I have heard from not only the people that I've been able to intervene with and talk with. That is critical. Some of the resources that are out there. One of the good ones I watched, The War Within, is by WRAL, and it's about a father whose son committed suicide, and his whole unit who experienced some pretty severe trauma while they were overseas. And another great one that I look at as far as a good YouTube video is where an old soldier meets young soldier, The Gap. It's on Lad Bible on YouTube. And when I said the 3 at the beginning, and I talked about that, it's that just to keep in mind that, we lose 22 veterans a day. So over 3 hours, potentially we could lose 3. So thank you very much for your attention today.
Thanks, Sean, and stand by because we may have some questions and answers. So if you appreciate your time. Joe Raade, I'm going to move to you next. Suicide is a big issue in the military and police. And I think if we're paying attention, Suicide rates are increasing all over the place, and it's something communities need to be sensitive to. Did you have a chance to watch that little section that Joe Zaladic gave at our first symposium on the work of firefighters and first responders, but the increasing rates of suicide?
I did. Chief Zaludic's a very good friend of mine, and he did a great job.
He did, and very sensitive. And so from what you've heard so far, how does the culture among firefighters and EMTs compare with other uniformed services and professions that provide service to our communities and safety?
There's a lot of commonalities between fire, police, EMS, hospital, emergency room nurses, and the military. Not at all trying to compare our service to the military, but we share a lot of that same brotherhood and sisterhood and exposure to some of the same trauma that can cause stress later.
How do you identify those who are maybe being overstressed with the demands of the work they do in a fire department, so that they get the help they need?
You know, that's probably one of the weaknesses, I'm guessing, service wide for fire and EMS, is that identification and how to recognize that somebody may need that assistance. Up until the last decade or so, fire and EMS specifically were kind of that mentality of they were tough guys, tough gals, and they just were expected to internalize things that they were exposed to. I come from a first responder family. My father was a firefighter, and my mother worked for a police department and retired from there. And I saw that with them going through their careers. And earlier in my career, up till the last decade or so, that was kind of the mentality, is you didn't talk about those things.
I've always had a theory that, number one, among volunteer agencies, I find lots of military veterans and uniformed service providers seem to have a good presence, and would providing service to others, maybe with PTSD or other trauma-related issues, be a good way for those in that industry to relieve some of their own stress as well?
That's how I've personally dealt with the stressors of being a firefighter throughout my career. I was raised to be a servant leader, and that's how I have treated my career. When I separate from the organization and go home, it's usually not to just be idle. I find my ways to serve the community in other ways, whether it's through the Rotary, the Boy Scouts, whatever it may be, to keep, to give back a little bit, and to kind of bring some self-comfort to not no longer having to respond in a fire engine or an ambulance any longer, until I go back. So,
do we have enough people doing that kind of work?
Enough people being fire and EMS?
Yes.
Is that what you're saying? We're starting to see a change. When I started my career in the late 80s, it was nothing to have a couple hundred people testing for 7 or 8 jobs. And then after that kind of died down a little bit, and then after 9/11, that returned right back. Everybody had interest in being a firefighter or a paramedic, and we've just in the last 5 or 6 years, we're lucky if we get 40 or 50 people applying for 4 or 5 jobs that may be open. It's no longer of interest to our younger population. And I can only imagine on the law enforcement side, it would really, somebody's probably really thinking twice whether they want to go out and suscept themselves to what our law enforcement officers have to go through now. The cops and the firefighters have always razzed each other, and but we've always been pretty tight, and we have a lot of common ground. But I can imagine being a young person now wanting to put on the badge to be specifically a police officer, I would encourage them to do so. It's a great career. I have a lot of friends that are police officers, but the public, as we know, has really lost respect and not for good reasons. So
Yeah, we're talking about defunding or reducing sizes of police departments, and that
yeah, it's
when you put more burdens on people, that's going to just simply increase the stressors and maybe drive those that remain,
yeah,
or even those thinking about entering into that type
yeah,
of profession, which is so necessary.
yes,
We may run out of resources for our own security.
yes,
So I'll share with the audience that I think there is tremendous opportunities out there for anyone who wishes to be engaged in something that will help the mental health issues in our nation. It seems to be an increasing area of issues, and it takes a certain amount of expertise and practical knowledge for assistance. So I'm thinking as a community, maybe we need to restructure to the extent necessary for crossover assistance in ways we can help, including recruiting of others to enter into those types of services, test and find out what works. It's not just a matter of money, really, with surface providers. It's a matter of the pride in the work that you do and how it helps people. And just a little appreciation would be a good thing. I'm a Vietnam veteran. Stephen Masson's a Vietnam veteran. We took some grief after that conflict, and fortunately, things have changed, and I believe it is changeable. Joe, anything else you want to add in terms of future directions and mental health for your profession?
So, like I said, over the last decade, we've kind of turned the wheel a little bit and are starting to recognize that our employees, both career and volunteer, are exposed to things that could cause them, serious stress. So we've just in the last a few years created peer support. We have statewide organizations that are starting to help us with that. We're trying to take some of that stigmatism away, that if you self-report, it doesn't mean you're weak. It means that you are actually strong. You're recognizing that you are dealing with these battles, and we're starting to find ways to keep our employees longer on the job. It used to be that we focused on physical fitness. Now we're focusing on the whole firefighter, the whole responder, that it's more than just being strong enough to do the job. You got to have the mental aptitude, but also be able to have the roundedness to be able to take care of the whole individual. And we're working on that right now and seeing great strides in that occurring a lot more often than in the past. So.
Okay, that's Joe. Raade, let's see, it's district chief, is it?
The division chief, yes.
Lane County Fire District. Mina, we're going to move to you. I'm actually going to use this as a segue also into ethnicity and gender as it relates to culture, but you're also a U.S. Marine Corps veteran, have a family of 6 children, and I think it's amazing some of the things that you've done. I came to know Mina, as we call her, in Guitars for Vets, and she's also involved with Veterans Arts Council, I think it is. So Mina, go ahead and take it from there. I may shut you off, but leave you as a transition into the next panel as well.
Okay, hi, my name is Citlamina Rios. I am a Marine Corps veteran of the Gulf War Persian War era. Did not serve in combat. I need to make that clear. A little bit of my experience as a woman in the military and a woman veteran is that a lot of times we're, not just myself, but I've talked to women veterans and even male veterans of different eras, mostly younger than me, that a lot of time we're afraid to come forward about what we're experiencing with what is now known as PTSD. Is not just the stigma of like having a mental health problem, but the loss of, while you're in the military, the loss of maybe your rank and loss of maybe your commission or your enlistment. One of the other things that I've come to know from other veterans that I've talked to is that as a veteran, trying to get help means that you might not be able to keep your civilian job or get hired into a civilian job because there's that stigma that has come not just from people talking, but also from media that, we can be unpredictable people. And it's not necessarily the case. There are people that at times can be unpredictable, but that can be with anybody. not just persons that are diagnosed with PTSD. And everybody's experience is a little different depending on what era they served in, their gender, their race, their sexuality, what branch of service, and even their job and whether or not they're enlisted or an officer. I was actually reading an article by Gregory Burrick, MD, MS, that's on one of the from the American Journal of Psychiatric Residents. There's individual experiences, but there's also shared experiences amongst veterans, men and women. And a lot of those experiences are because, as he says here, they give up a piece of their individuality to become part of something larger than themselves. A lot of veterans that I've talked to, and even while I served, I would ask, well, currently I'm working on, I have a residency, I'm an artist, I'm a photographer mostly, and I'm interviewing and photographing veterans with PTSD, how they are living their current life while they are working through their PTSD, if that's what they're choosing to do. And there's a lot of shared experience in that. A lot of the veterans that I've talked to, including myself, were looking something, not just something bigger than the self, but something to belong to, something that was worth giving up their freedom for. And not just like, well, not just the kind of freedom where like you can't do what you want to do, because people still do what they want to do in the military, oftentimes with consequences, but something that's bigger than the self that makes them feel like they're a part of something, like there's a family that they're involved with. And maybe not necessarily because they don't have family at home, but maybe they feel left of center of their family experience within their own generation. I've also come to know that a lot of veterans join because they want to experience something that somebody older in the family had experienced, whether a parent or a grandparent, an uncle or an aunt, or even a sibling or a cousin. And so that's a shared experience. And those shared experiences bring common traits, according to this article: sacrifice, discipline, you hold yourself to higher standards, teamwork, being part of something greater, belonging, loyalty, brotherhood, which also includes sisterhood, a fighting spirit, never giving up, suppression and denial. This is where the kind of like holding back and not really discussing your trauma in a serious manner. A lot of times it is discussed with like sarcasm or dark humor. But a lot of the veterans, even ones that I've talked to with PTSD, even ones that might have what they consider like a hard exterior, they have a compassion and they will talk with somebody and somebody that they feel comfortable with. And usually that is another veteran. And some of the veterans I've talked to have discussed that it's easier to talk to a veteran that they feel comfortable and can trust than it is to their therapist, their mental health provider.
On that point, I've heard from many veterans that they have trouble dealing with clinicians in a mental health setting, and they prefer to be dealing with people who have a better understanding of their problem. Do you see that as a problem?
Yeah, a lot of veterans, and also simply to say myself, I have a problem with group therapy. I feel like it's invasive, but that could also be the culture I was raised in. I was raised in a culture where we didn't talk about anything. Anything negative that happened, you don't talk about. Shut up, be quiet. No one needs to know about that. So that's my experience. A lot of veterans that I've talked to said they wish that they could have this kind of like, like movie experience kind of therapy where they can go on a walk in a park with their clinician and talk in that manner. And a lot of them have also been referred to programs to kind of help them, kind of like the Guitars for Vets that we did. And a lot of them, they're like, well, I really don't want to identify as a veteran because they have some sort of guilt about survivor's guilt, or they feel like veterans that have a PTSD that isn't combat related are like, well, I never really did anything, so my trauma doesn't level up to that experience of others veterans, so they don't want to identify that way. And not that they're ashamed of their service, it's that they feel that they have not or did not do what they intended to do when they enlisted, especially if they enlisted during a wartime era. So
I'd like to ask you a question on the gender and assimilation of females into the military. And sometimes I've read that women have greater issues with PTSD than men. I don't know if that's true or not, but do you have any comments on what she?
My comments on that is, I think maybe we express it more than men. Men, not just in the military, but in maybe different ethnic cultures, are not allowed to express their feelings or the emotions or things that they've gone through. So while more women might cry or have outbursts of breakdown, men, not just men though, also they show it in anger or aggression or in other ways that might seem negative. They're not necessarily negative to be angry or be aggressive within a certain confines, depending on your situation. But both men and women also do self-harm, including overeating, not eating enough, drug and alcohol abuse, also acting out sexually. So there's a lot of different things. My suggestion is when you're not, and I use this word not in a negative way, confronting a veteran about you think that they might be dealing with some PTSD, is not always refer them to like these indoor therapeutic situations, but there are organizations out there that do outdoor things, and it's not in great big settings, like not great big groups. There is one, and I can't remember the name of it off the top of my head, but my friend who I went to high school with, who's also a Marine Corps veteran, as well as her husband, he did it where he was trained and had some people hike the Appalachian Trail with him as a form of therapy. So it's not always these indoor things, these big group therapy sessions. It's like outdoor situations. For me, I recently had a heart surgery on September 30th, so I'm able to exercise now. My biggest therapy outside of my one-on-one talk therapy, because I cannot do group therapy, has been doing CrossFit. I'm physically able to do it with some accommodation. It's not something that everybody's willing to do. It is a group situation, but I know myself, so I go early enough in the morning where there's like maybe 3 other people. That's what I can do. The other thing I've taken up is hiking, and I have a hiking partner who's also a veteran with PTSD. And it's just getting into those situations. One of the best things as you know, I came into Eugene as a homeless veteran with 5 children with me. My other child is an adult. He lives out of state. One of the best things that worked for me was outside of the homelessness is that I was sent to CWT, which is kind of part of Voc Rehab, sort of. And it's Certified Work Therapy is what it stands for. Mr. Gardner in San Bernardino County in California. And there I met a couple other veterans. I only worked with 2 other veterans, which was perfect for me, but it was outside. We started talking to each other. That's how I met my hiking buddy. And we're able to discuss things with each other, even though our PTSD is very different, because I never went into a combat zone, but we're able to have this camaraderie in a way that I can't, personally for me, cannot have with people who have not been in the military and don't have that kind of connection and understanding to the military, even though we were in different branches of the service. And the other thing is that when dealing with PTSD and you're trying to work with a veteran with PTSD or a service member that may be transitioning out but still enlisted, is a lot of times people want to involve a caregiver in it. Not everybody has the privilege of having a caregiver. Not everybody has a partner of some kind. Not everybody has family that understands. And so instead of automatically offering caregiver support, find out first if that veteran has a caregiver, and if not, maybe find a situation where they could have what we still call outside of the military as a veterans is a battle buddy, somebody that they can go to. And then again, not everybody has that. So I think caregivers or providers, whatever you want to call them, clinicians need to just take things on an individual basis instead of just grouping us all together on how things can be worked out, how things can be addressed.
Basically a team approach. And I think it's helpful to have a lot of those who have had similar experiences work together, because there's a certain bonding by understanding, I think. I'm going to cut you off there, Mina. I did have a question on tagging. What is it? And I had a photo I'm just going to show. I hope you can see that. This is a sign with the hands. It actually spells out blood. It was a sign for the Bloods of the Bloods and Crips. Tagging is a way with graffiti that you see painted on fences and any number of other things that are usually symbolic of particular gangs, and it's a claim of territory, and as was described already, can even be a way to pass on threats, death threats and things of that nature. So it is serious stuff. And to even remove a tag can in some ways be, can bring danger to the person who is perceived to be resisting the claims of those gangs. So these are things we need to get more exposure among the community to just get grasp of the problem. Okay, let's go ahead and cease the recording.